Hi, my name is Annika Dalla. I am 24 years old and I'm currently a junior showmanship judge for AKC and ASCA for the Australian Shepherd Club of America. I judge for juniors and I have been a part of the junior showmanship program in both venues, starting as early as when I was a peewee at 3 years old. Growing up in the world of dog shows has always been a fun hobby of mine, and I'm excited to share my knowledge with you today. And today we're going to go over some new and fun and exciting things, and I hope you guys enjoy it. Please remember to like and subscribe down below.
Today we're going to talk about the anatomy of the Australian Shepherd breed using this image. And then another image of the skeleton, and then we'll talk about their anatomy of their mouth. I'm going to start up at the top by their face with their nose. Everybody knows that the nose is where they use to smell and they use to are typically black or leather, depending on the color of the dog. And if you move up in between their eyes is their stop, a little bit past their muzzle. Then you go up to the top of their skull, in the very, very back of their skull, right before you hit the neck is their occiput. I kind of remember it as like occiput. Sounds like octopus. That's kind of how I remember it. It's at the base of that skull, right there. Then you have their ear leather. If you like to wear leather boots, or any kind of boots, pretty much they're typically made out of some type of leather. And that's that soft, like inside pink area when you fold their ears. Okay, then you have your crest and going down into your neck, and then their withers. Their withers are the top of their shoulders, and that's where you use to measure the dog and know how tall they are. Then you've got from running from the withers down to their croup is their whole top line. So if you ever hear me or anybody else refer to their top line, that's what they're talking about, like their whole back. And then past their withers is to the very, very last rib is more specifically like their true back part of their back as their anatomy. Then right after their withers, their ribs, but right before their hips is their loin. If you like to, there's like pork loin or pork tenderloin. That's kind of the same part of the pig. Where it comes from is right in that section right there. Typically, that's also what they call the doggy's waist as well, going that way. And then their croup is their tushy, which is struts right past their hips, running down to the base of their tail or their stub, depending on if they have like a short little tail or a naturally bobbed tail. If we continue running down the backside of their butt or their tushy into their hindquarters, you'll have there's a little knob there that kind of sticks out. It's called the hock joint. It's or it's also referred to a little bit pretty close to it, is their rear pastern is back there. It's kind of like their hock, kind of like their ankle back there. And so if you come up around the front of their back leg, where the stifle is their knee, and that's a very important thing because a lot of doggy athletes injure muscle group around that area, and then if you keep coming up that direction, you'll get to the flank and their tuck up, which is kind of like the skin below the loose skin, around that loin area on their bottom side, where typically where like their belly is. And then you come to their ribs. On the side of their ribs is where their shoulder would be, and then they have an elbow just like what we do, and their elbow is pretty significantly protruding, so you should be easily be able to find that. If you find the elbow, you are pretty close to where the brisket is. And then you also have the forearm coming down the front part of the leg, and then you have their front pastern up there too. And then you've got going back up towards the chest, where the brisket is. The chest has got a very prominent like little knob area that's in the very front. That's also called the sternum. We as people have a sternum, and ours is like the very middle of our chest. And theirs, in an Aussie and in other breeds as well, they are, when they're standing, it's the very middle of their chest as well. And then to either side of those, of that sternum, if you can find the sternum, you can find the point of shoulder on either side, which is literally as it sounds. It's the pointy part of their shoulder blade. And then if you keep coming further up, back up into their face, you'll see that their muzzle, which is like more of where their whole mouth part is what it's referring to. And then there's flews, are like the gum lips that you lift up to show the dog's bite during the exam portion of the junior showmanship rings, as well as confirmation, to make sure that they have a full dentition of their mouth. The way that I remember it is when you have the flu, and you're like coughing a lot, and you're sick, or if you're sick, cough, cough. You'll see me and hear me pretend to cough, as a way to kind of cue you that's what I'm talking about. When I ask for where the flu is, and you want to go lift up those gum flaps, to show their teeth, and that's where it is. And then we come back up into their nose leather, which again, that's what they use to smell, and that's how they view the world. They use their sense of smell first before they use their eyes, and then they use their hearing before they use their eyes. Actually, is how they view the world. We as people, we view the world with our eyes first, then our ears, and then our nose, which is kind of a unique thing. With a different type of image, which has got more of the fancy terms or the scientific terms of their bone parts, as well. And I'll start again with the head and kind of going down the back and around the butt and tushy, all the way up, back up into their head, just like I did in the other one. So of course you've got their muzzle, which is what it looks like. Then you've got your stop right in between their eyes, because it slopes to a stop. Then you've got their forehead, which would be their top of their skull in the other one. And of course it shows you exactly where the occiput is. And I feel like the occiput is a little bit more easier for you to see here on this one, than it is on the other one. And then you have their neck, which is also called their cervical vertebrae. And that's what the bone part of that is actually called. Then you have your thoracic vertebrae, which is closer towards their withers. And then you have it runs from the withers, in between the withers, down to the back, and into that back area that was shown on the previous one, but before you get to that very last rib that they have. And then, of course, it shows you the loin, which is also called the lumbar vertebrae section, which is, once again, before the hips, but after that, in that space before, after the last rib. And you've got the croup that leads right into the tail, or lack thereof. And then you've got their pelvis, which contains their hip. And then their ischium. Their ischium is literally, as it's pointing to, is their butthole. And I know you might be giggling right about now, but it's okay to laugh at that. The ischium is their butthole. And then you have got their femur. Their femur is like their upper thigh, part of their body there, for their hind legs. And then it shows that their britches, which are, I like to call them panties, for their feathers, which is kind of like the fur that's on their tushy. Okay, and it shows that where the patella is, or the stifle joint. That's what it's also referring to. Patella, stifle joint, also meaning knee. If you can get somewhere close to that, then you'll be fine. The tibia and the fibula, which are like their muscles that are their bones that are near their calf, what we would consider their calf. Okay, and then you've got the tataris, which is what they call their hock joint, and then their metatataris, which is their rear pastern. Following back up in the front of their hind leg, which is also called the hindquarters. You still have your tuck up and your flank shown here in this image as well. It shows where the rib cage is, which is also their chest. Coming down their front legs, they've got their feathers, which are like that fluffy part down there of their fur. And then in that bone structure, you have your radius and your ulna, which is also their forearm there. Then you have your carpal joint, which is like their wrist, basically. And then you've got their metacarpals, which is more parts of the wrist. And then your phalanges, which are also known as their toes and their digits. Coming up into the chest area, once again, you've got your breastbone, which is part of the chest, and then the humerus, which is also part of the chest area, and the point of shoulder there. And then they, of course, going back up into the face, they have the underjaw, which is the lower jaw part of their muscle that they use to help chew. And then you've got your upper jaw, which is also part of is directly linked to their skull. They are supposed to have a scissor bite. And the way that I describe remembering what type of bite that they are supposed to have is that you use scissors to cut for arts and crafts, while they have a scissor bite to bite into and shred other types of meat and dog food. Here is the teeth in the mouth inside of what an Aussie's bite's supposed to look like, and what each of the 4 different types of teeth that they are called. So we're going to go front to back. So their front teeth is called their incisors, and then right behind their incisors are their canines. Right behind the canines are their premolars, and then the very, very, very back of their mouth are their molars. As you can see, they have each of these types of teeth on their upper and their lower jaws. For the most part, all you're going to need to know really in terms of teeth is that talking more about their canines, but you could be asked about all 4 of these different types of teeth, like how many incisors does an Aussie supposed to have, how many molars, so you can go through and count those, and I do cover those in another video of a little bit more in depth. Mostly what I have been asked in terms of teeth in the junior showmanship ring is where are the canines, what is a canine, and how many, which the canines are their largest teeth. There's only 4 of them, and they are right behind their incisors or their front teeth. Sometimes the judge will ask you to distinctly show where certain teeth are, so then in which case you need to actually get down on your knees and actually show using your dog that is connected to you, hopefully, and show exactly where those teeth are. I hope you have enjoyed a brief overview on some anatomy of the Australian Shepherd breed, and I hope to look forward to seeing you guys in the next video. Enjoy, and I hope you have a great day.